Alright, so this week's video is on tuberculosis, and the first question is, would you expect it to be harder to treat it when it is in latent form? I think it'd be easier to treat it when it's latent, mainly because when it's active, it may need a lot more antibiotics at different levels as the virus becomes more and more resistant. And in latent form, you may just need one of the first-line drugs like rifampin to kill off any TB cells before they do become active. And active cells can escape the tubercle, which may become systemic instead of just localized, which could harm more tissues and organs and need more antibiotics. So I think it would definitely be harder when it's active. And for the ethics question, I think it'd be wrong to put an infected person in jail, but I do believe that quarantine of some kind would be necessary, just not like a jail setting, especially because there are so many people in and out of jail complexes, guards and people being released that could contract the patient's TB, so it'd be kind of counterproductive if that occurred. You'd have more people infected with TB, even though you were trying to keep it under control. So if an area could be designated for people with extreme TB infections, that would be more appropriate, like a nice island or, hospital wing. Or another option could just be to make sure the patient wears gloves or a mask or anything that would prevent the spread of TB to others, like kind of putting them in a bubble. But this would cause unwanted attention, and the patient probably would not follow through with that. But I do believe that quarantining them would be the most effective way to stop the spread of TB.